Tummy tuck's gone wrong. Okay, what do I mean by that? These are some things that can happen that can make the results of the tummy tuck not as good. And these are things you want to watch for and talk to your surgeon about before you have surgery in order to avoid these things happening to you. Number one, incision too high. What do I mean by that? If the incision is too high, you lift up the pubic area, it's peeking out above your bathing suit. It's also creating a look with an incision that's very high that is kind of flat and not super well designed for your body. There's very few ways to fix this. You can make a lower incision, bring the skin down, and that's one way to revise it and get it below the panty line and make things look nice. Number two, not enough liposuction or too much liposuction. What do I mean by that? Liposuction changes the shape of the body, and the right liposuction can make the body look the way it should, like an hourglass shape. Over liposuctioning in some areas can create lumps or bumps. We call them contour abnormalities. Under liposuction can leave you square. So you need to have just the right amount of liposuction. I'm going to tell you right now, in patients that are like a BMI of 30, that's probably around 3 liters, BMI of 30 to 35. Someone who's super tiny, BMI of 19, maybe it's like 500 cc's to a liter. But most patients that are seeking a tummy tuck, you need a lot of liposuction in order to get a good result. Number three, skin necrosis, partial skin necrosis, complete skin necrosis, areas where the skin does not survive. Why does that happen? Well, there can be problems with blood flow to the skin. Also, the binder or the garment that's going on top, if it rides up too high, it can press down on the skin and decrease the blood flow to the skin that's on its way to the incision. And if you decrease the blood flow to the distant part of that skin, it will not survive. It can be fixed with hyperbaric therapy, wound care, other treatments. It can slowly heal over time, but you've got to deal with stuff. You might have to do a scar vision, some lasers, other things to really improve the quality of that skin. And although it sounds terrible and the pictures look crazy in the beginning, 3 months out, they actually look okay as long as they're treated well. So that is one of the other things that can mess with your result. The last thing I would say is inappropriate or incomplete repair of diastasis or not enough skin removed with a tummy tuck. Because tummy tucks are all about creating a flat, tight tummy. No tummy is completely flat after surgery, and some people have a little bit of a pooch above and they may need a little bit more skin resolved, or there may be some swelling from lymphatics in that early time frame. You got to hold the patient's hand throughout the process. But tightening the muscles on the inside is a critical piece to the surgery. It gives you core strength back. And if you don't get that tight, patients complain they have issues. Or if it separates because it's not well repaired, that can be a problem. And if you don't take enough skin with the tummy tuck, if you're not using progressive tension sutures to take as much skin out as possible, you can be left with a little bit of laxity or looseness to that skin. It happens to even the best surgeons, and skin when it's poor quality, and older patients can have that at a higher risk, or patients that are weight loss patients have that at a higher risk. And it requires surgery to fix it. You need to do another surgery to take out more skin and improve that result. So these are some of the things that can lead to a tummy tuck gone wrong, things to consider. Keep in mind, every tummy tuck is done differently with different techniques, but the truth is it's all about the basic principles to create the best shape and the best outcomes.